Okay, here's the magnesium options. Starts with these. That's for bowel movements. And then up here. So there's way too many here. I think
Yeah, that's oh, sweet. Thank you. We have 1,005.
this is the one.
Thank you.
Pills. I usually go 2 pills to 3 pills twice a day. And I just happen to be requiring more magnesium than the average patient of mine. But I do believe it helps with regards to bowel movements, muscle cramps, helpful sleep, because lower magnesiums bring on fretful sleep or interrupted sleep, in addition to palpitations and anxiousness or anxiety. So the idea is that you don't just willy-nilly figure out, I want to take this vitamin, this vitamin, this vitamin because I saw it on TikTok. I think it's important to realize as the data evolves and big pushes or drives are going to be put out there in the internet on buy this because it's the newest thing, you still have to be suspicious of the data. And I think that using data to drive what is probably going to help you the most is important. So I would break it down into a hierarchy as far as where do I buy my vitamins and what should I be taking. I'd break it down to a hierarchy of first, finding or declaring what you're deficient in. And I have a patient, for example, that we checked a magnesium level on, and this is a magnesium level, and the magnesium is not bad. It's within the green, but my suggestions are to get to a level of 6.4 if you get your blood test with Quest. And 6.4, I think, is maximizing it. Almost the same as B12. There's very little downside to magnesium and B12. There is a downside to vitamin D, and there's also a downside to iron. But with regards to magnesium and B12, I say crank it up. Now, there's some problems when you get the wrong type of magnesium, and it just makes you poop or have bowel movements that you fart and then poop goes through. What's that called? A shard? But that's a side effect. And that's usually only with cheap vitamins. And I did purchase this online from down south. I was visiting my son in Dallas and I wanted to pick up a magnesium bottle. So I went to Sprouts over there, and they don't have Now Foods, they just had this. And I thought, okay, it might be good. Let me just get this. And plus there's B6. B6 sometimes helps with sleep even further. Well, I took at least 2 doses and started having loose bowel movement. Not for me. Even though the type of magnesium is higher, it's aspartate, but there's something with this aspartate that doesn't agree with me. This aspartate does work, and there happens to be potassium here, which I believe I'm aldosterone, meaning I secrete a lot of aldosterone. I haven't tested it yet. But I'd say 1/3 of people with high blood pressure are suffering from hyperaldosteronism. And nobody tests for it. I have to get better insurance before I go testing myself with aldosterone levels and aldosterone-renin ratios. But in the meantime, I'll just take potassium and watch my potassium because it's a cheap test. And I'll take magnesium until I have buffered my symptoms or side effects. Again, for me, the side effects would be fretful sleep, some slight high blood pressure, and some muscle cramping. Now, certainly the muscle cramping can be because of me overtraining. And if that's the case, I'll scale back, but I won't stop exercising. But I've always been a muscle cramper. When I was a kid, I'd get Charlie horses or calf strains all the time, meaning cramps after aggressive training with my sprinting. As a young adult in college, I remember my roommate in college, Tony, rest his soul, he had to carry me back from the gym, Heyman Hall, because I was just cramping everywhere. I was either underhydrated or I just, again, overtrained. Or I could have been overheated. Doesn't matter. Bottom line is that I found that magnesium for me has to be pushed high as possible. I try to get levels of 6.4 or above. And just so I can give you argument, that's how I would play getting a deficiency test. You take some blood tests. You have to withdraw from your blood your vitamins 3 days before. That way you're only testing what truly is in the red blood cell intracellular. And then you get your blood tested and you go back on the vitamins and you meet with your provider, hopefully me. But in many cases, everybody knows about vitamin D. This has been pushed for at least the last decade. Before that, it was never pushed. And actually, because of its popularity, it's now covered as a wellness test. So you don't have to worry about your insurance charging you. Now, this person's vitamin D was terrible, and she's taking vitamin D. So there's something wrong with either the dose that she's taking, 1. 2, the brand that she's taking, maybe it's inferior. 3, maybe she's taking the right dose and the right brand, but it's not getting absorbed, so her gut. Those are the 3 variables that have to be taken into consideration. Without going through a big litany of working on the gut, as far as poop testing, I like Genova, by the way, I pull on the easiest levers. The easiest levers are brand name, could be inferior, or dose will be off. So in the case of vitamin D, I think that vitamin D, if it's fixed properly, within 3 months should pop back up. So this test says I have to look at her vitamin D and then decide on what we're going to do, whether it's increase the dose or change the brand. It's probably going to be increased dose. I don't want to. I think patients are fair at finding their go-tos, their go-to companies, and that would be the next topic: is which company is good. And I happen to like Now Foods brand as far as the magnesium, and it's a local store for the Fruitful Yield nearby, and the prices are pretty decent. I think I can get your average bottle online if and when I used to shop at Amazon. I can get it online 50 cents cheaper with no shipping, but I just don't trust Amazon anymore. I'd rather go to Fruitful Yield's website and order from them, paying for the shipment, or just go to the store. And as I mentioned in the previous video, there are benefits to shopping because you can, within 30 days, get credit and then try your next one and then your next one until you find a vitamin that's good for you. Now, I'm not talking just about magnesium. I'm talking about B12, iron substitutes, B2 if you're a headache sufferer, curcumin or turmeric if you have inflammation and or Alzheimer's disease, your choice of beetroot for its nitric oxide increases. So there's several different things that are important. Again, I don't do every vitamin level test in the world, but I think it's important to at least check B12, iron, magnesium, RBC, and then vitamin D. And people who take copper or zinc, I'd check both of those things because taking one will usually negate the other. So when you take copper and or zinc, and a lot of people dove into zinc during COVID, sometimes taking one will make you poop out the other. So you could be taking enough zinc to help you with your immune system, but your copper is going to go low, and vice versa too. So I would do that and deploy. I would also check vitamin C levels for folks that are dealing with cancer. I think vitamin C, when it's low, can really impact the way your immune system works. That's what Linus Pauling came up with a long time ago. And there are some IV infusion centers that just do pure vitamin C as a complement to their chemotherapy. So, and then there's the deficiencies of the type of food that you practice. So if you're a plant-based, vegan, low-fat, you do have to check your vitamin B12 level and your iron level. And then even if you're taking those things, you want to make sure that the iron and ferritin are good and your B12 is appropriate. In some cases, iron will be normal, but a ferritin will be low, and I think in Europe they use ferritin more than iron. In some cases, B12 will be normal, but your MMA will be low, so I sometimes will also get that. If I have a patient that takes Pepcid, Zantac, omeprazole, pantoprazole, any of those acid blockers, not the antacids, but the acid blockers that you see, Zegrid, you have to be careful because the acid blockers will rob you of your vitamin. So they rob you of B12. They also rob you of magnesium, and they can play around with other Bs as well. And you can't negate the Bs. I think that we as doctors assume that everybody has a good B level. But if you watch one of my previous videos I did on mitochondrial optimization and zone training, the mitochondria specifically are dependent on a couple of things: CoQ10, melatonin, B2, and B3. And you would think, yeah, you probably got enough, but I've checked a lot of people, and those that are suffering from cancer and or some autoimmune disease where I need the white blood cells to work properly, I need them at a high level. And I've checked a couple, and it's really tanked down low, lo and behold, and then we had to supplement them, or at least we had to tell them what to buy. So going back to that's how you figure out what you have to take. And again, it's up to your doctor to figure out what your symptoms are in addition to those things. So you check blood tests for standard deficiencies. You check blood tests for deficiencies associated with your nutrition practice. You check blood tests depending on your medical diseases that are found. If you're a diabetic, if you're high lipids, if you have high blood pressure, there are certain supplements or vitamin deficiencies I'd look at. I can't list them all here, so I'm just talking about what to buy. And with the upper levels, or the entry levels of, okay, take care of a deficiency, you don't feel anything, but we'll just add this because you're maybe you didn't realize you're having cramps like me. So I would not spend too much money on those supplements. So for my muscle cramps and or my difficulty with sleep, I will just go with this. I can certainly go with the fancy one, Orotate. This actually gets in the data. It says this type of magnesium gets in far faster than this magnesium. But there's a price point here that's a little bit unaffordable. So for entry-level deficiencies, I think it's fair to go with a good company. How do I assess good? I would usually at least look at Consumer Lab. And I suggest that if you're a vitamin shopper, you subscribe to Consumer Lab and you check out the vitamin that you want on the Consumer Lab review. Then they usually pull a whole bunch of them off the shelf, they test them, and they see if the company is actually putting in the capsule what they put on the label. So they've called a couple of big companies to the carpet, and I like what they do. They don't test everything, but they do test enough. So if you do have your favorites, test them out on Consumer Lab and see if they've approved it. If they have not and it's not approved, then don't buy that brand anymore. And that'll bring me to my next point, and I've already mentioned it. I don't like Amazon. I think that Consumer Lab also, I found out through a patient of mine, Consumer Lab did a query or assessment of two companies, a mushroom company and a Now Foods brand. And those companies during COVID had gone and bought their own product on Amazon, and they found a drastic number of products that they purchased from third parties selling their product. The drastic number were fake products or counterfeit vitamins. So same label, but essentially nothing in the capsule. And it happened to me at one point in time. I was wondering, why is this magnesium not helping? Because I was getting my palpitations at night back. And I thought, I'll increase the dose. Still didn't help. I'll increase the dose further. Still didn't help. So I decided to put the brand that I had away and try something different. It did work. My palpitations went down. Eventually, I had the diarrhea or loose bowel movements from the other brand that I got, and I think it was KAL. So I went back to this, but I bought it in the store. And since I purchased from the store, I haven't had any problems, which I believe I was a victim of that counterfeit practice that some third parties did. That's just my opinion. But I would be very cautious online, and I would buy from the vendor's website. So Fruitful Yield, just go to Fruitful Yield to buy Now Food products. If you're going to buy Vitamin Shop brand, buy it from Vitamin Shop. If you're going to buy Colistin HPF, which will be my next topic here, is what do you expend a lot of money on as far as quality? And I would go then to the next issue. If you have medical disease, like I'd mentioned before, you can have deficiencies, that's fine. You can have some symptoms, that's fine. But if you have medical disease, like you're fighting diabetes, if you're fighting hypertensive emergencies, if you're fighting memory, if you're fighting plaque formation and high cholesterol, or impending heart attack like myself, then I wouldn't buy standard stuff, and I would not rely. I do trust Now Food, but I wouldn't rely on them for reversing my disease. I would go all out, and that's where I go with Biotics Research. I don't have it here, but I go with Biotics Research, red yeast rice, and berberine. I happen to buy their CoQ10 as well, but just for the sake of lowering or decreasing the narrowing of my coronary arteries, especially my Left Maine or the Widowmaker, I wouldn't just go with what Consumer Lab had suggested. I'd go with the best I can find, and I like Biotics Research. I like the company. It's family owned. It's not sold out to big food, and that's what it comes down to. Big food and big pharma is buying everything up, but it hasn't sold out yet. And I like how they hunt for their small sardine fish off the coast of Cuba, instead of buying the fish from Norway, shipping it to China to get distilled, and then putting it back here to get packaged. There's a lot of time there. So I just like when you get the fishermen, they go to the factory, they get it distilled and processed, and it's right there ready to go and ship around the world. So I just think that they're a good company. And for that sake, I test the dose. So I have personally tested my Colistin HPF, which is Consumer Lab's top pick for red yeast rice. I'll just use red yeast rice as an example. And it did lower my lipids and without giving me any side effects. And then I tested out Biotics Research, making my diet and nutrition, my exercise unchanged. I just changed one variable. That would be going from Colistin HPF to Biotics Research. It bottomed out so the Biotics Research bottomed out my LDL cholesterol 20 more points. Now, it's only a study of me, an N of 1, but that's significant. I mean, usually lipid-lowering statins can move your target LDL by 20 to 40 points. This is red yeast rice, and it's a higher end. Number one, the Colistin HPF is still, I like it. I would not buy that it's not available on Amazon. You can try to get it on Vitacost. I'd buy it straight from Colistin HPF's website. So they're still number one rated on Consumer Labs. But if you do have a disease that's happening, if you do have a narrowing that we've documented, no, man, go for the best. That's where you put all of your money. So your investment has to be with that. And certainly it's just anecdote, but I would spend higher amounts. And yes, some people spend hundreds per month on vitamins. I don't necessarily agree with that. I think you should take that money and put it into food and maybe a personal trainer and a trip somewhere to celebrate. But in the case where we're trying to take people off of their prescription medicines onto lifestyle, exercise, nutrition, and supplement, I might go higher end with those big medical diseases. Again, I'll summarize it with the smaller things like vitamin deficiency symptoms here and there, food choices. I'd go with affordable and a good company. It has proven by Consumer Lab. If you have a disease that we're trying to reverse, don't mess around. Don't mess around with cheap shit. Go put your investment in that. And then after we hit that plateau of safety, then maybe we'll pull you off of that and fix your nutrition. But that's how I would play it. I would always want to, if you're in dire straits, you have to be on medicines and you have to have the surgical procedure, but most of my patients are not there yet. A couple of them that come to me, they're really tired of the diseases that they're suffering from, like MS or heart disease or diabetes or obesity, and they come to me to help guide them. And I can usually do a pretty decent job because I can think outside the box of what they've done and what they're thinking about or what they're confused with, and definitely what their doctors. I have no problems with my colleagues, but we just don't have the time. In standard-based medicine, you have 15 minutes. You can't really figure out things in 15 minutes. You can essentially fill out the chart, get reimbursed, and then give a fast Band-Aid, which is usually a prescription. So there's nothing wrong with prescriptions, but I think there is something wrong if we don't move past that and try to fix the human being. So I think this human being is, not this one, but all human beings are miraculous in that we can reverse disease. But if you're way to the end of the disease process and then you want to reverse it and you weigh 300 pounds over your target weight, you have to be patient. It's going to take a lot of time. So the idea is don't just give in, but still chip away at that to get back to where you were before. And I'm not talking about high school weight. I'm just talking about being fit and youthful. If you're youthful, you can fight. If you're aged and fragile, it's going to be tough. So hopefully this gives you a couple of ideas about how to shop for vitamins. This is not meant to be a substitute for your health care, so please take this information to your doctor or join me at my practice and share this with people who are spending way too much money, or they're not sure what to do, or they're buying every vitamin in sight, so consider subscribing to my YouTube channel, because I put these out every week on empowering you to get healthy as possible. Thanks.